Good morning, everybody. Happy Thursday. Hope you're staying warm on this chilly morning, and we so appreciate you being here for this event, which we've lately made an annual conversation about how to prepare for new laws that are effective in the new year. So this is a look forward to what's coming, and we will plan to share the recording and the slides and all of the related links following this event. So please feel free to just sit back and relax and take it all in, and you'll get all the materials once we conclude this morning. Feel free also to use the chat as we move through the program to ask questions to each speaker. We'll try to cover questions about each topic as we go, since they're all fairly discrete topics. And some of our speakers will be coming in and out of the program because of other commitments. So um, if you need to raise your virtual hand or put a comment in chat or speak up verbally, any of those is fine. And I'm going to take a minute to introduce our panelists, and then we'll hand it off and begin diving in. So on the next slide, you'll see a brief snapshot of the agenda. After I introduce panelists, we're going to talk about state requirements and opportunities in the new year, and then follow that up with a conversation about federal changes. And we have a great panel of expert speakers to cover these topics. And then we'll cover any remaining questions that we haven't gotten to yet at the end of the program. Um, on the next slide is a list of our esteemed panelists. Oh, I thought there was a panelist slide. Maybe not. I'm going to mention who they are. First, from the Illinois Department of Labor, we've got Lydia Kalunga Merchant, who is the Leave Rights Division Manager at IDOL, and she's based out of Chicago. At the department, Lydia works to ensure compliance with Illinois' leave rights laws, including the Paid Leave for All Workers Act, and she conducts outreach to inform both employees and employers of their rights and obligations under these laws. Prior to joining the Illinois Department of Labor, Lydia was the Deputy Chief of Workplace Rights Bureau at the Illinois Attorney General's office. Also from IDOL this morning with us is Anna Keppel. Anna is the Legislative and Policy Director at IDOL. She resides in Springfield, and she also serves on the department's serves as the department's rules coordinator. She has served in these roles since 2020, and prior to working at DOL, she was a researcher and lobbyist for a construction labor union. Anna is originally from Jacksonville, Illinois, and graduated from the University of Missouri. Welcome to both of you, and we appreciate your time. Also with us this morning is Alex Pleasant, who's the Chief Executive Officer at the Southeastern Illinois Community Foundation. Alex is based in Robinson, Illinois, and previously served as the Executive Director of the Crawford County Development Association, and he's actively involved in local nonprofits across the region in Southeastern Illinois. He has a bachelor's degree and a law degree from the University of Illinois, Urbana-Champaign, and Alex is also a former Forefront board member and also very involved with the Alliance of Illinois Community Foundations, and is here to help speak on behalf of the Community Foundation community in Illinois. Next to finally, we've got Sarah Sadian, who is the Senior Vice President of the Public Policy and Campaigns for the National Council of Nonprofits. Sarah lives in Washington, D.C., and previously served as Senior Vice President of Public Policy and Field Organizing for the National Low-Income Housing Coalition. Sarah has more than 15 years of experience with national campaigns and advancing policies on Capitol Hill. She graduated from the University of Connecticut School of Law after receiving her bachelor's degree from the University of Virginia. She's also a member of the Virginia State Bar. And finally, Nadine Israel is the Senior Vice President of Policy and Advocacy at AIDS Foundation Chicago. Nadine spent the last decade in the health policy and advocacy field in Illinois, working across the state on issues impacting the Medicaid program, the Affordable Care Act, mental health and substance abuse, housing, and state budget and tax policy. Nadine previously served as the Director of Policy and Advocacy at EverThrive, Illinois, where she led the organization's policy development and implementation efforts on issues that focused on maternal, child, and adolescent health. Nadine holds a Master's of Arts from the University of Chicago's School of Social Service Administration and Social Policy, and a Bachelor of Science from the University of Illinois in Business Administration. So we have a great panel this morning with national and local and statewide experts on all kinds of issues. And we so appreciate their time. It's such a busy time of year and everyone's starting to slide into home. And so thanks for being here today and paying attention to these important issues. So I'm going to hand it off to my teammate Lacey, who will do a brief review of Forefront for you all, and then she'll hand it directly to IDOL to dive in. Thanks so much.
Good morning, folks. Just give you a brief background on Forefront. So we are the state membership organization for both nonprofits and philanthropy in Illinois. We have a fundamental commitment to educate, convene, and mobilize the sector on a statewide level. And while we're doing all those things, we're making sure that we see everything in advancing racial equity in Illinois. So for the policy team, we make sure that any of the policy or bills that we're working on have a lens of racial equity. The members that we service are individuals, operating nonprofits, so that could be array from health, human services, arts, museums, and etc. And we also service all types of grant makers, from private to family to corporate foundations. I'm controlling the slides. Slides. Yeah. Yeah. Um, for all our stakeholders, here are some of the things that we have for folks. We have our biweekly newsletter. Um, we have Philanthropy Club, and this is a no cost for folks who are looking to receive funding and access to funding. We have our Equitable Access Capacity Initiative, Business Sustainability Initiative, and we have our Public Policy and Advocacy, which you can sign up for as well. Some of our policy partners that we work really closely with a lot of national organizations, including National Council of Nonprofits, which we are working really closely with. I know a lot of folks probably have been hearing their names kind of in this policy world, in the nonprofit world, a lot of the lawsuits they're doing. So we really appreciate all the hard work they're doing to help protect the sector as a whole on a national level. We also work really closely with United Philanthropy Forum, Council on Foundations, and Independent Sector. We also work really close with statewide organizations that are service coalitions. You may recognize some of your organizations on our screen as well. Oh, it got flipped. Here are our panelists. And then I am going to hand it over to IDOL to go over employment law refresher and updates.
Hey, thank you, Lacey. My name's Anna Keppel. As Holly mentioned earlier, I'm the Legislative and Policy Director at the Department of Labor. I should say I had some dental work this morning, so if I sound funny, it's because I'm still working with a bit of Novocaine. But I do our legislative work, our advocacy in the Capitol, and I'll let my colleague Lydia introduce herself.
Hi, everyone. Lydia Colunga Merchant, Leave Rights Division Manager here at the Illinois Department of Labor. Great to be with you all.
Next slide, please. So we wanted to give you a little bit of background about the Illinois Department of Labor. As our name implies, we are the State Department of Labor. We're not the federal government. We're the state of Illinois Department of Labor under Governor Pritzker. And we enforce about 25 labor laws, including the minimum wage law, overtime law, wage theft laws, paid leave for all workers, which Lydia is going to talk about, equal pay, which I'm going to talk about, child labor law, and many others. And the mission here at the Department of Labor, which we really believe in, is to protect and promote the wages, welfare, and working conditions and safety of Illinois workers through our work. And part of that is providing compliance assistance to employers and increasing public awareness of workplace protections. And presentations like this really give us the opportunity to hit on those, second components of, we see this as compliance assistance, informing employers of their obligations, giving them guidance for how to comply, and where to come to ask us further questions if you have questions about your compliance obligations. And the last note here, I think, is really important, that our work is to ensure that employees are treated fairly, paid what they're owed, but also that employers who follow the law remain competitive and aren't, undercut by bad actor employers. Next slide, please. So just wanted to give you a little bit of information about the Department of Labor. If you ever are in a position as an employer where you hear from us on something, in addition to, we actually conduct investigations, we hold administrative hearings to make determinations if there's been a violation of labor law. But we also recently created an informal resolution unit to explore methods to proactively resolve disputes between employers and employees. If sometimes it's just a misunderstanding between the two, a miscommunication between the parties, it's a misunderstanding of what the law requires. And we really would prefer to resolve things, without it having to be a huge cost to the parties and a big stressful ordeal. If we can just put in some effort to bring both sides together and see if it can't be resolved. And I will also note, as employers, you're familiar with the break room posters that are required to be put up, not necessarily in the break room, but that's what I call them. Those are available for free on our website. You can just print them out. I know that there's places that sell them, but if you don't want to go that route, they are on our website for you to just print wherever. Next slide, please. So I wanted to start, this is not a new law, but because we've got so many of you here representing different workplaces, we wanted to take this opportunity to get the word out about our on-site safety and health consultation program. This is a program where DOL staff, who are safety consultants, if you request it, they will go out to your work site, look around, and help you identify workplace hazards and make recommendations to eliminate those hazards. This is a free and confidential service to really try to support employers who are committed to workplace safety without it being punitive. And you can request a consultation by going to worksafe.illinois.gov. Can we go next slide? We just have like a 2-minute video explaining this program. I think you can click play if that does not work. Can I share my screen, or can I drop it's just on YouTube. I can drop the link in the chat if you want to share your screen, whatever you prefer, Holly.
Lacey, why don't you stop sharing and let Anna share, and
Okay.
then we'll go back to the deck. Thank you.
The Illinois Department of Labor's on-site safety and health consultation program is a free service to small, medium-sized employers, including in the construction, manufacturing, and healthcare industries. This program assists employers in reducing injury and illness rates, decreasing workers' compensation costs, and increasing productivity by identifying potential safety and health hazards. Working together, employers and our skilled consultants will develop systematic strategies to control potential hazards based on OSHA requirements and NIOSH best practices. In addition to conducting safety audits and industrial hygiene surveys, the program reviews OSHA-required written programs and assists in developing an overall safety and health management program. The Illinois Department of Labor staff can also provide specific training and seminars, along with printed and electronic resources. The on-site safety and health consultation program is voluntary, confidential, and separate from state and federal enforcement. Our consultants do not have the right of entry, nor can they issue citations or levy fines. Unlike state and federal OSHA enforcement, our program is employer-driven. Employers must request our services and agree to correct the identified serious hazards before consultation services can be provided. Employers also determine the level of help or consultation services they require. Our consultants may evaluate specific operations, programs, or the entire worksite at the employer's request. Our consultants work with the employers at every step of the process, from scheduling a convenient opening conference to providing a detailed closing report. Before a walkthrough, consultants meet with the employer to determine which services to provide and outline the employer's obligation. At the end of the consultation process, consultants will develop a closing report that outlines any identified potential hazards. On-site union representatives are invited to participate throughout the process. Knowing what is wrong and how to fix it are two different challenges. Illinois On-Site Safety and Health Consultants will offer general approaches and recognized industry strategies in controlling identified hazards. Our consultants can also suggest outside resources for technical help. If a small to medium-sized employer is interested in these services, contact the Illinois Department of Labor On-Site Safety and Health Consultation Program by visiting our website, worksafe.illinois.gov, or emailing dol.consultation@illinois.gov.
Okay. I'm going to stop sharing. So Lacey can go back to sharing. There we go. And on that, on consultation video, I wanted to say, I know that the video was like very heavy on construction images and sort of like heavy duty work images, but I would really consider it for any kind of work site. If you have a warehouse, if you've got like programming where you're inviting the public in to do stuff, we don't limit it by industry, right? And there could be safety hazards present that our consultants could take a look at and make suggestions on. Next slide, please. Okay, I'm going to hand it over to Lydia to start talking about some of the laws that she oversees.
Yeah, thanks, Anna. So we did want to mention a couple of new labor laws that are going to go into effect next year in 2026. So the first one you may have heard about is an unpaid leave for parents of babies that are in the NICU, which is the neonatal intensive care unit. And so this new law goes into effect June 1st, 2026. So that we know laws usually go into effect in January, but this one goes into effect June 1st, 2026. So it creates an entitlement of up to 20 days of unpaid leave for parents of those babies in the NICU. This is a law that is enforced by the Department of Labor. So our Leave Rights Division will be responsible for that implementation and enforcement come June. So we are currently working on guidance. We don't have anything to put out to employers yet. But usually we'll have FAQs, more information, one pagers, any other materials prior to that effective date. So you can always visit our website, labor.illinois.gov, and there we usually put out a lot of good information about these laws. So again, this would apply to employers with 16 or more employees. So if you are a smaller not-for-profit, you might have, if you have between 1 and 15 employees, then this leave wouldn't apply to you. It's only if you have 16 or more. 16 to, I believe it's 50 employees, get up to 10 days. And then if you have more than 50 employees, then it's up to 20 days. The next law I wanted to talk about is commonly known as VESA, or the Victims Economic Security and Safety Act. So it's not a new law, but there was a recent amendment added to it. So just as a reminder, VESA provides unpaid but job protected leave or reasonable accommodations for employees who either they or their family or household members are victims of domestic violence, sexual violence, gender violence, or any other crime of violence. And it provides them with, I believe it's up to 12 weeks of that unpaid leave. It is a sliding scale based on the number of employees in the workplace. I know that it does apply to very small employers. So even if you have just one employee, those employees would be entitled to VESA leave, although it wouldn't be 12 weeks. I believe for smaller employers, it's up to 4 weeks. For those medium employers, it's 8 weeks. And then the maximum is up to 12 weeks. And again, there are specific enumerated reasons that employees need to, they can use this leave for, such as seeking medical attention, seeking counseling, participating in legal proceedings, seeking out, safety services if they need to, move or relocate to a shelter, making sure that they or their family members are safe, things of that nature. That's what this leave is meant for. So I know we're also working on updating our materials and having more FAQs. But again, this new amendment, it will take effect starting January 1st of 2026. And so it establishes that employers may not penalize employees who use a work-issued electronic device to document an act of violence against them. So, this amendment was passed after there was a similar situation in New York where there was an employee who documented evidence of domestic violence. She was penalized, by her employer for, using that, that device. So, this is something just to keep in mind. It doesn't make a drastic change, to the general provisions of the law, but it's just a reminder that employees, who are these victims of violence, should be able to use that work issued electronic device if there's an emergency. Next slide, please. And I'll hand it off to Anna. Oh, back one. There we go.
Yeah, I just wanted to briefly touch on this law. This law is not one that the Department of Labor is responsible for enforcing. We don't have any part of this law, but I think it's a really broad and important labor law change for employers and employees to know about. So if you have further questions on this, I'm sorry, I probably really can't answer them, but you should consult your attorney. This law prohibits employers from, so originally this law has existed since I think 2019. It prohibited employers from making employees sign non-disclosure agreements related to, like, if the employee has been the victim of sexual harassment in the workplace, an employer can't make them sign a document saying they will keep that a secret. And this expands this to say employers cannot require employees to sign contracts or NDAs that prohibit the employee from discussing unlawful employment practices of the employer, such as like laws that we enforce, nor can they make them sign a contract or NDA that would prohibit the employee from engaging in a unionizing attempt. So I would say if your workplace is in the practice of having people sign contracts or sign NDAs, consult a lawyer to like make sure you're in compliance here. Okay, next slide, and I think back to Lydia.
All right, thanks, Anna. So this is meant to be a refresher on the Paid Leave for All Workers Act. As you know, this went into effect on January 1st of 2024. So I can't believe we're coming up on 2 years now of this law. But as a reminder, the Paid Leave for All Workers Act entitles nearly all employees working in Illinois to earn and use up to 40 hours of paid leave per year that can be used for any reason of their choosing. And so this includes part-time employees, temporary and seasonal employees, as well as employees of small businesses and not-for-profit organizations. And so also, we get a lot of questions about, from employers who have those pre-existing policies and how the law affects them. And so as a reminder, any employer who has a bona fide qualifying pre-existing policy that allows all employees to use 40 hours of paid leave or a prorated amount for any reason of the employee's choosing is not required to provide additional paid leave time or modify the terms of their policy. I do want to note, that under the Act, employees cannot be retaliated against for using their 40 hours of paid leave time, including being assessed attendance points. And this is a protection that applies to those qualifying pre-existing policies as well. So we know that there are a lot of employers that may have those qualifying pre-existing policies, but this Act ensures that all employees have access to those 40 hours of leave, without the fear of discipline. And again, as long as the employee is following the employer's paid leave policy. Next slide, please. So this act applies to any employer who doesn't have a qualifying pre-existing policy or isn't covered by a local paid leave or paid sick leave ordinance in effect on January 1st, 2024, and meets the minimum standards of, PLAWA. So we know typically this means, if you're an employer in the city of Chicago with employees working in the city of Chicago, then The state paid leave law doesn't apply. Instead, the Chicago paid leave and paid sick and safe leave ordinance applies to your employees. We do not enforce that. That would be the City of Chicago's Office of Labor Standards. And you can email them with any questions about the Chicago ordinance at bacplaborstandards@cityofchicago.org. Similarly, if you are in Cook County, have employees that work in Cook County, it is possible that they may be covered by the Cook County paid leave ordinance. We know that there are some municipalities in Cook County that have opted out of the county ordinance, which means that our state law would apply. We know it is confusing, but please feel free to contact the Cook County Commission on Human Rights, human.rights@cookcountyil.gov, for any questions, including whether the municipality is covered by the Cook County ordinance or the state law. Next slide, please. So employees under the Act can either accrue their paid leave time gradually throughout a 12-month period or have their time front-loaded at the beginning of the 12-month period, so long as employees are earning 1 hour of paid leave for every 40 hours worked, up to 40 hours of paid leave per year. And so this isn't 40 hours worked in a work week, it's just 40 hours worked total. So if you have a part-time employee who maybe works 20 hours per week, at the end of 2 weeks, then they would have earned 1 hour of paid leave. Employers may have separate policies that provide front-loaded paid leave for some employees and accrued paid leave for others. However, the policies must be applied consistently, be clearly communicated ahead of time, outlined clearly in a written paid leave policy, and not be illegally discriminatory. So as long as your employees understand why some employees may be getting, front-loaded leave versus, accrued leave, we've seen where full-time employees that are salaried usually just get everything front-loaded versus like those part-time or hourly, they accrue their paid leave gradually. That's something that, we're like, that's allowed as long as, in your policy you outline like that's how those employees are going to get their leave. Also to note, if you are front-loading that paid leave, the Act prohibits an employer from making an employee repay paid leave time that was front-loaded at the beginning of the year due to a separation from employment or working less than anticipated. So benefits that have already been provided may not be retroactively diminished. So again, the Act only applies to 40 hours. So if you have, 40 hours under this Act, and let's say an employee, they get their 40 hours at the beginning of January, they leave in June, and they had used their 40 hours of leave, an employer cannot make them repay like 20 hours. That was a benefit that was provided to them under this law, and, that benefit can't be diminished. Next slide. So for employees who may be FLSA exempt or, overtime exempt, so those employees that fall into this administrative, executive, or professional exemption, the Act does allow for, them to just earn or accrue 1 hour of paid leave per week, even if they worked more than 40 hours in a work week. So for example, you have an FLSA exempt manager at an office, they typically work 45 hours per week. So for paid leave purposes only, they would earn 1 hour of paid leave per week, even though they worked more than 40 hours. And so because the Act requires employees to accrue 1 hour of paid leave for every 40 hours worked, including any of those overtime hours, it is really important to carefully review the FLSA definitions of administrative, executive, and professional employees to ensure compliance, because that may be an issue. So, in those situations, it may be important to speak with your attorneys to make sure that, all of your employees are correctly being classified. Next slide. So paid leave begins to accrue or must be front-loaded on the employee's first day of employment. Employees are entitled to use their paid leave time after a 90-day waiting period following that first day of employment. So employees, unless of course the employer chooses to be more generous and lets them use their time sooner. But the accrual begins on that first day of employment, or that front loading, all their hours should be in their bank day one. But then they would have to wait 90 days in order to use it, unless the policy says, they could use it sooner. Employees are paid at their base hourly rate of pay for any paid leave time taken. And then for any employees that are receiving tips or commissions, they are to receive the full minimum wage rate, which is $15 per hour, or their agreed upon hourly base rate, whichever is higher, for any paid leave time taken. So for example, if, a server is, given has an agreed upon base hourly rate of maybe, $17 per hour instead of the $9, then here it would be that they would get that 17 instead of the $15 per hour. So it's whichever is higher, the full minimum wage or that agreed upon base rate. Employees who accrue their paid leave gradually throughout the year must be able to carry over up to 40 hours of unused paid leave into that next 12-month period. However, employers who provide front-loaded paid leave, those employees are not entitled to carry over unless their employer chooses. So again, if you're accruing gradually, then you do have to carry over any unused time. But if you're front loaded the paid leave at the beginning of that 12-month period, then it's more of a use it or lose it, because you have more time to use all of your hours. Next slide, please. So an employer must adopt a reasonable written paid leave policy that at a minimum includes the protections of the Act and the rules, and shall be provided to employees on the first day of employment. If you have that pre-existing policy, again, you don't necessarily have to modify your policy, but it may be helpful to, communicate to your employees how your, pre-existing policy is already in compliance with the Act. Employers must allow for oral or written requests to use paid leave. However, the employer's policy may require the employee to provide written notice after making an oral request for paid leave. Very important, employees may choose whether to use paid leave provided under this act prior to using any other leave provided by the employer or state law. So, and if there is a choice and there is this separation, like you're providing paid leave, and let's say you have a separate paid sick leave bank, you cannot force your employee to have to go through their paid sick leave bank first before they could use this time, or vice versa. It is the choice of the employee to decide, this is the type of leave I want. Under the Act, an employer can't ask for a reason why someone's using the leave, but they can ask, which bucket of leave are you, seeking to use? That way, for record keeping purposes, they know which hours to deduct from which bank. Employers can have a reasonable notification requirement. So it can be 7 days advance notice for foreseeable leave requests, and as soon as practical for unforeseeable leave requests. Next slide. And employers can deny employee requests to use paid leave if the employer's policy for considering leave requests is disclosed to the employee in writing. The employer's policy establishes certain limited circumstances in which paid leave may be denied to meet the employer's operational needs for that requested time period. And as a matter of fact, the employer's policy is consistently applied and doesn't effectively deny an employee adequate opportunity to use all paid leave time over a 12-month period. So there may be times where you do need blackout periods. Like we know we're in the holiday season, so retail stores may have a blackout period for certain days. So as long as, the blackout period isn't, 9 months out of the year, like we want to make sure people are being given that opportunity to use their paid leave time, and employees know when the blackout periods are, and when they, that way they know to plan ahead. Next slide. Oh my goodness. So I know this is long. I think this is close to the end. So very important is that paid leave under the Act, it does not require a payout of unused leave unless the leave is credited to the employee's general PTO bank or vacation bank. So if you've already had that pre-existing policy or you're just combining all the leave, then you would have to pay it out. But otherwise, if everything is separate, you don't have to pay it out. Employers are required to maintain records regarding employee paid leave balances, accruals, usage, etc., even if you do have a qualifying pre-existing policy. Employers are required to post the paid leave public notice in the workplace. You can find that on the website. And again, this is even if you do have that qualifying pre-existing policy. Retaliation, again, is prohibited under the Act. Specifically, it states that employers shall not consider an employee's use of paid leave as a negative factor in any employment action that involves evaluations, promotion, discipline, or counting paid leave under a no-fault attendance policy. So if you do have a points-based attendance system that leads to discipline for absences, any instance when an employee is utilizing paid leave under the Act may not be counted against that employee. So again, it's only 40 hours. If you provide more than 40 hours of leave to your employees, then those additional hours could be subject to that attendance policy, but the Act does provide protection for those 40 hours. Next slide. All right, Anna, I think that's to you, but I'll double check the chat to see if there were any questions.
There were a couple of questions and I did my best to answer them, but you should go through and, I defer to Lydia on these questions. She enforces these laws, but I did my best to try to provide some quick answers.
Go ahead. No, go ahead. I'll try to go in the chat.
Just for time. So I also wanted to present a refresher on some recent changes to the Equal Pay Act, which affect many employers in Illinois, anybody with more than 15 employees. So as a refresher, the Equal Pay Act, traditionally, it prohibits an employer from paying an employee less for the same or substantially similar work on the basis of sex or race for African Americans, right? Like that's the traditional Equal Pay Act I think most people are familiar with. Here in Illinois, as of 2019, the law prohibits employers from seeking or requiring a job applicant to disclose their pay or salary history, right? So on an application form or in the interview, employers should not be asking, what are you making now? What did you make at your last job? Anything like that. As of 2021, private employers with more than 100 employees must register with the Department of Labor to get an equal pay registration certificate and provide certain data to DOL. If you think that applies to you and you're not sure if you've been doing it, you can follow up with me after and we can try to bring you into compliance. As of January 1 of this year, employers of 15 or more employees must, when you make a public job posting, you must include pay and benefit information on that job posting. We call it pay transparency. Next slide, please. So this provision applies to employers of 15 or more. The job posting must include a good faith pay range and benefit information in any job posting you choose to publish. Does not mean you have to make a job posting for any particular opening. But if you are posting a job opening, it should have a best, good faith estimate of the pay range you're willing to offer and what the benefit package is. Also, additionally, if you're an employer who has 15 or more employees and you publish a job opportunity externally to the public, you must also within 2 weeks, and you can do it the same day, but it has to be done by 2 weeks. You must notify your current employees of that opportunity so that, one, they can have the opportunity to apply if they want. And also, I think it's important because it gives employees a sense of what you think the market rate is for that position. And that's, information that is good to be transparent about, according to the General Assembly. And we receive, we only look into these pretty much if we receive a complaint, if we determine that a covered employer's job posting does not comply with these requirements and the job posting's still up, we will give you an opportunity to fix the violation, right? We will say, hey, it looks like you're missing this. We know it's a new law. Here are the things that you need to have. And check to make sure that you're coming into compliance for the future and not be penalized for that first or second violation. Next slide, please. So this also applies if an employer uses a third party, an agent, or a service to announce your job openings. So, you know, LinkedIn or Indeed.com, or if you have a recruiter that you use, anything like that, you have to make sure that if they are reaching out to people or they are posting a job posting on your behalf, that also includes the compensation information. So if it doesn't, you can still get, be held accountable. Unless you did provide it to them and it was their mistake, then the losses, they are liable. But just make sure that any job postings that are going out on your behalf contain this pay and benefit information. And I will also take a note to say, like, if it is something online, like that, the information can be in the form of a link to your website that explains your benefit package. That's fine. Next slide, please. So I didn't want to go into like super great detail about all the various like questions that folks have because it's kind of a complicated provision when you get into it, but you can see our website for FAQs such as, and if you can just hit like the button and things will pop up. How does this apply to remote work outside Illinois? What kinds of benefits are we talking about? Are we talking about perks like free parking? No, not really. Can I just recruit somebody I like into an open position? We have a new position. I've been working with somebody for a long time. They seem great. I want to ask them to come over. Do you have to make a job posting in that circumstance? No. And then, of course, what are the penalties for a violation? And again, that process for kind of getting a warning to come into compliance for the first couple of times that there was a violation. So, I can ask, Peter asked a question in the chat. What does it mean that employers are not required to make job postings? Can somebody be promoted without posting for all employees or externally? Yeah, Peter, that's exactly right. So employers are not required to make job postings for any position, for a new role, or for a promotion. But if you do make a job posting, as many employers do when they're looking to hire someone, that job posting has to meet these certain criteria. Similarly, if you want to just promote somebody because you think, they're the manager, you have a manager who leaves to go work someplace else, you've got a staff member who you think would be a great leader, you can just ask them if they want to be promoted up. Although in that circumstance, if they ask you what the pay is, you have to disclose it. So that's the pay transparency element, but you don't have to publicly announce the salary and benefits unless you are making a job posting to solicit applications or resumes. Okay, next slide. I think that actually might be it. Yeah, so we can have a moment for questions. I have to leave at 10:30 and I think Lydia does too, but we're here for questions in the meantime, or you can follow up with any of those email addresses there.
Yeah, Anna, thank you. And Lydia, so much for that extremely detailed, helpful information. For the sake of time, we're going to have to move on. I want to protect the time of our other panelists because we're significantly past where we were scheduled to be. So, but since you can stick around, if folks have questions for you, if you could use chat, that's perfect. And certainly still welcome. So, and then if there's additional questions at the end, we'll tackle them there. But I apologize, we need to move on. I'm going to quickly set up Alex here so the next state issue we wanted to make folks aware of, and then Alex will take it from there. So there's a new program that was enacted. The next slide summarizes where you can find the background on this. Looks like we might have some sort of weird thing pasted on there. We'll get that out of there. But this program was enacted in the Revenue Omnibus Bill in May of 2024. So we had a delayed effective date where this law goes into effect on the 1st of next year. And rulemaking is underway now for this program. And what this program does is stipulate that when a community foundation uses charitable funds to repay all or part of a worker's student debt, a worker that resides in their jurisdiction or the geography they serve in it and is serving in a job that that community needs, that worker would not be responsible for paying income tax on that debt repayment to the state. So it doesn't touch federal income tax, although we have been trying to get the federal government to do the same thing. But what this does is provide our state kind of a neat private sector, privately funded solution for both workforce development and student loan debt in our state. So community foundations can help broker an arrangement where they know the needs of their community and what jobs are needed in their community and help recruit workers into those jobs by offering to repay part of their student loan debt when they reside in that community and work in that job for a certain period of time. So I'll put some related resources in chat, and Alex is going to take it from here and talk about why community foundations care about this and how you can participate in the program.
Yeah, thanks, Holly. So there's off the start, there's a lot of specific terminology in here that I suspect people may have questions about what kind of job and what kind of what qualifies and some of the different rulemaking things. And I'm just going to trust that Holly and everybody will be able to connect you to some of those definitions because being mindful of time, I think probably me reading a half dozen definitions to all of you is probably not a good use of everybody's time. So just to give some background, to give a big picture to help kind of explain what's going on here. Community foundations, charitable foundations were spread all over the state. The biggest, oldest, most famous one is the Chicago Community Trust, but there are community foundations that serve every community in Illinois. We're charitable foundations with a geographic focus. Virtually all community foundations are going to have scholarship programs. That's probably the thing that we're sort of best known for is that we give out a lot of scholarships in our local communities. The idea here, really, behind this program was, is there a way to use that same kind of basic mechanism of local donors funding individual students? Is there a way to do that on the back end when we have students who've already gone out, gotten an education, have accrued some student debt, and we'd like to recruit them back to our community. We'd like to recruit them to fill a particular community need. Can we do that? And of course, the answer to that has always been legally yes, but there was this income tax component to it. Because student debt is a liability, right, of an individual, it's a debt that they owe. If you pay that debt for somebody else, they have to claim that as income, right? That is the alleviation of a debt is one of the basic definitions of gross income. If you go look up the IRS definition or the DOR definition. So what we were trying to do here is decouple that, right? And say, really, this is more like a scholarship than you paying off your brother-in-law's car dealership, right? Like it's not debt and repayment of debt in the same way. This is more like a traditional scholarship. When the scholarship kind of world was created, when the basic guidelines around it were created, student debt was a trivial thing, right? We're talking about the original guidance was all set in the 1950s and 60s. Tuition at the University of Illinois was $400 a year. Student debt was not a big issue. Now that we're not in that world anymore and student debt is a big issue, we're trying to find ways to use that same core principle of charitable dollars that help, charitable dollars that help a student's finances, that help make that transition easier and also recruit them into our communities. The way we can do that is get the Department of Revenue and get the state to kind of concede that really this is just a post-graduation scholarship, right? That's the other terminology that you will see for these sometimes is post-graduation scholarship, and that really does lay out kind of what the underlying rationale is there. So it's a program that is available to community foundations. The definition of what is a community foundation is a lively and interesting discussion that we've been having with the state over a couple of different issues. But if you look in your area, I think Holly can also connect you with, if you look up an organization I'm involved with called the Alliance of Illinois Community Foundations, we have a handy map that will show you where all the community foundations are. If you reach out to them, they can help you with one of these programs, right? They're very new. You may very well be the first employer that is approaching them about this, but they are typically going to be an eligible entity, and they're going to be the ones who can help navigate this. So if folks have questions, I'm happy to answer questions. If not, I know that was quick, but we will hopefully be back on track time-wise. So
Thanks, Alex. Yeah, and I shared some related links in chat. You can read the fact sheet that summarizes the program, also the actual law that goes into effect on the first. The map Alex mentioned is in chat as well. And then some of the data that map out why we care about this in terms of like some of the disparities around student loans and also new breaking news from Urban Institute on the increase in loan delinquency. So we do think the loan crisis in our country, which has arguably been exacerbated due to recent federal actions, is going to create demand for these types of programs at the state and local level. So the reason we're sharing this with nonprofit employers is because nonprofit employers are specifically eligible under this law to use this as a tool to get workers that you need at your nonprofit. So if we know nonprofits employ all kinds of hard to get jobs. And so if that's something that you think might help you, reach out to the community foundation nearest you to talk about how you might be able to leverage this. Thank you, Alex. We're not quite back on track, but we're getting there. So at this point, we're gonna switch gears here and look at federal issues. And I know a lot of you are probably here for this conversation. And we're focused today on the impact, both good and bad, of of HR1, the tax bill that passed this summer. And so first, we're going to hear from Sarah Sadian from National Council of Nonprofits. And she's going to go over the changes to charitable tax policy that were in that bill. And we know a lot of you may not be aware of them because we've paid so much attention to other parts of the bill. So we, in particular, want those of you that are involved in any way in fundraising, this is where you should make sure your ears are turned on if you've been waiting for this, so you can plan for charitable tax policy changes in the new year. Sarah, go ahead.
Absolutely. Thank you so much for having me. I'm looking forward to talking with all of you. We can go ahead to the next slide. I just wanted to take a step back before we dig into what's new in the tax bill, just to say thank you so much for your advocacy when Congress was debating this tax bill. It ended up in a much better spot than it could have been, and that was originally proposed. And the reason for that is because all of you played an important role in weighing in with your members of Congress and encouraging policymakers to take out some of the really bad provisions that we didn't want to see happen. That being said, the bill on the whole includes some bright spots. I'll talk about the bright spot in a moment. But ultimately, what we're going to see is decreased resources for nonprofits through charitable giving, as well as decreased funding for states, which means more pressure on state budgets and less resources for nonprofits through that way too. So you should be aware of sort of the overall context that overall it will decrease resources for nonprofits, even though I'm going to spend most of my time talking about the positive element of the tax bill and what that could mean for your organizations. Next slide. So the big bright spot in this bill is a new universal charitable deduction to help offset and encourage charitable giving from those who do not itemize their deductions. This is a permanent provision. Many provisions in the tax bill were time limited for 10 years or less. This is unlike those. It is permanent. It does not expire. There is no sunset clause. It's the way forward going forward. And essentially, it provides a tax deduction, above the line tax deduction for individuals up to $1,000 and for married couples up to $2,000 for the year. It starts in 2026. So starting on January 1st, you can start using this as a recruiting tool for fundraising from donors who maybe haven't given in the past. The Joint Committee on Taxation estimates that it could generate $74 billion over 10 years for nonprofits. And it's important that you're aware of it being out there and start to use it as part of your plans for getting resources. Next slide. So what's great about this new universal deduction is that it democratizes charitable giving. Prior to this, the major tax benefit for giving was only available to individuals who itemize their taxes, which at this point is about 10% of all tax filers. So the vast majority of those of folks who pay their taxes weren't eligible for any incentives for charitable giving, and now they are. Something to keep in mind is that it is not indexed for inflation. So of course, over time, that $1,000 and $2,000 cap aren't going to feel as powerful. So next year is when it will have the greatest impact. It is for cash contributions only. DAFs are not eligible as a source for this. There are some requirements for nonprofits to provide documentation for any contributions made above $250. And there was some past history that we've had with this idea. During the pandemic, there was a provision very similar. It only provided about $300 as an incentive for charitable giving, and that led to 90 million taxpayers making use of it. So we think that this could be a really important tool in your toolbox for raising funds. Next slide. I'll mention a little bit about the other changes that might counteract the good benefits of that universal deduction. Again, things for you to keep in mind. One is a new cap on individual itemizers. Essentially, it reduces the value of giving for those highest income earners who are claiming their deduction by itemizing their deductions. Independent sector estimates that could reduce charitable giving by $40 billion. All of this is to say this could lead to greater giving this year before that provision goes into effect. So you should keep that in mind, that now is the time to really maximize end of year giving before this cap goes into place. The other changes is a new floor for individual itemizers. This was used in part to help pay for the universal deduction that I mentioned earlier. The Joint Committee on Taxation estimates that this too will decrease charitable giving because you only can claim the itemized deduction for contributions made above the 0.5% floor. From what we've seen, many people are expecting that this might lead taxpayers to give less frequently, but in higher amounts when they do, right? They'll want to overcome that floor in order to receive their tax benefits. So whereas they might have given every year at a rate that was about half a percentage point of their taxable income, maybe they'll do it every 2 years at 1% so that they can try to maximize the tax breaks that are available to them. And lastly, there is a new 1% floor on corporate giving. Again, you can only claim the deduction once that corporation goes above providing 1% of a floor. Also expecting corporations to give less frequently, but at higher amounts when they do. All of these go into effect starting in 2026, so you should be aware of that. Next slide. When you think about the new opportunity, though, to engage non-itemizers, I wanted to share a little bit about the profile of these individuals so you know who you're trying to target with your outreach. Non-itemizers tend to be younger. They tend to have lower or moderate incomes, less of a history of giving, doing charitable giving, and they tend to give in smaller amounts. But as I mentioned before, 90% of all tax filers don't itemize and would therefore be eligible for this new benefit going forward. Itemizers, on the other hand, tend to have the very highest incomes. They're often homeowners because when they itemize, they can also claim the mortgage interest deduction, or they live in high tax states Illinois included as part of that. Just to give you a sense of the difference between itemizers and non-itemizers, in 2022, which is the last year that we have full data for, 2/3 of taxpayers with incomes above $500,000 itemized compared to just 2% of taxpayers with incomes below $30,000. Next slide. I am going to actually turn it over to Nadine, who's going to share some of the other provisions that were in the tax bill impacting Medicaid and SNAP. Over to you, Nadine.
Thank you so much, Sarah. Good morning, everybody. Nadine Israel, she, her pronouns. I'm with AIDS Foundation Chicago and today with the Protect Our Care Illinois Coalition as well. So I know you've had a long hour already, so these will be very brief. And unfortunately, nothing good in these slides when it comes to OBA. So I'm going to highlight very high level the Medicaid and SNAP changes that are in HR 1 or the One Big Beautiful Act, or as I call the ugly bill. And then the third slide will be on some impacts directly to employers that y'all, I'm sure, are keeping in mind already, but to lift up. So when it comes to Medicaid, the HR 1 cuts $1 trillion from Medicaid over a 10-year period. The estimate is that it's going to increase uninsured rates in that country by 11.8 million people, so just under 12 million people by 2034. For Illinois, the estimates are somewhere between 26 to 51 billion in cuts to Medicaid that are going to come out of Medicaid from the state over the same 10-year period, and an increase in the uninsured rate in Illinois of somewhere between 270,000 to 500,000, again, specific to the Medicaid cuts. The ranges are big, obviously, depending on some of the numbers that were used, but also there is going to be some control for the state. So it's going to be really important for the advocacy piece of it for us with our state, especially over this next year. So some of the key pieces in the law when it comes to Medicaid, and this is one of the main pieces of how people will likely lose their Medicaid coverage, even when they qualify, is that it requires burdensome new work requirements for individuals 19 to 64. So it's called the work requirement. There are other activities that could meet it. So they must complete 80 hours per month of work and or qualifying activities. The list of qualifying activities is still being fleshed out. There's rules that we're expecting on this part of the law as well from the federal government, but education and training activities, generally speaking, are included. And this has to be verified at least once every 6 months. So unfortunately, the work requirement is not something that somebody can show just once and that's it. They have to do it once every 6 months. And this particular provision, the work requirement provision, the projection is that this will be responsible for the majority of people losing their Medicaid benefits over and over, not because they don't qualify for Medicaid anymore, not because they don't meet the work requirement anymore, or that they don't meet it in general, or are exempt from it, but because they can't get through the administrative hurdles. And these, I should also say, these are going in for Medicaid, they're going into effect, the work requirement, this next change, at the end of 2026, so December 31st, 2026. So really 2027, the start of 2027. The next major change, this again also, within that same slide, if you can go back on it, applies to eligibility for the same population, the ACA adults. Right now, eligibility is determined once every 12 months. In this law, the eligibility will have to be determined for Medicaid members once every 6 months. Again, this is going to lead to people falling off of Medicaid, not because they don't qualify anymore, but because they can't get through the administrative hurdles. It also ends eligibility for Medicaid, period, for some legally and lawfully residing immigrants, including refugees and asylees. There's a table that has a list in it than other presentations that we have shared that we can also share if folks want to know more info on that. And then when it comes to funding, there's a lot in there in terms of how the state will lose funding, billions of dollars, that 26 to 51 billion that's going to come out of Medicaid over a 10-year period. One of the biggest ways that's going to happen is through something called the provider taxes. That is like an allowable thing that states can do when it comes to Medicaid. and how they can pay their share of Medicaid. So it puts a cap on provider taxes that gradually goes down. And that's going to be one of the main ways of how states will lose billions of dollars over this time period from the Medicaid program. Next slide, please. Okay, so that was Medicaid. Turning to SNAP very briefly. So all there, we have about 1.8 million Illinois residents that are on SNAP right now. And just for reference, there's about 13 million people or so in Illinois. That 1.8 million includes nearly 650,000 kids. So everybody on SNAP will see their actual true value of their benefits decrease over time because of this law. Some specifics within the law: 450,000 Illinois SNAP recipients are at risk of losing their benefits because of burdensome work requirements. So SNAP is a little bit different than Medicaid because Medicaid has never had a work requirement. This is the first time in its 65-year history. SNAP has had a work requirement for some people. However, we haven't had to actually implement it for different reasons. There are waivers and exceptions that we qualified for. So this will still be the first time where we've had to really implement the SNAP work requirement in such a massive way, hence the drastic impact. It also eliminates, there used to be existing work requirement exemptions in SNAP for certain groups of people: veterans, youth aging out of foster care, unhoused people, and those in areas with limited job openings. These people are no longer exempt from the work requirement because of this law when it comes to the SNAP benefit. What the projection is that maintaining the SNAP program, it could cost the state $800 million or more per year. So that's money that the state is going to have to decide where they're going to find it, or it could risk our state having a SNAP program altogether. Next slide, please. So when it comes to both Medicaid and SNAP, thinking about putting like the employer and nonprofit employer hat on, some of you might have seen this already with Plan Year 26. But you might be, if you haven't, you'll likely see more drastic increases in the cost of healthcare coverage for your employees. So even though the law, HR 1 didn't touch private health insurance for large employers or outside of ACA much, because of these changes, drastic changes to Medicaid and the ACA coverage, we are going to see private health insurance in general for everybody costs go up over time because of this law. You will definitely see, so anybody that's a frontline staff that works, direct service staff, or anybody that interacts with clients, they will have more demand on their time. So if caseloads used to be, let's say 25 to 1, that ratio may no longer work because each person is going to require more time and more service because of all these burdensome work requirements and other requirements are in the law for Medicaid and SNAP in particular. Another piece, and when thinking about the folks that you serve, are increased demand for services in general. So, for example, if refugees and asylees no longer qualify for Medicaid, they're going to have to rely on free and charitable care when it comes to their healthcare, more reliance on food pantries if they are in or near poverty. There will certainly be increased demand. If you haven't felt it yet, you will, for private philanthropic dollars for those of you who are private funders on this call. And we certainly we know that private foundations can't fill the gap, but you can do something to help alleviate the harm and alleviate the pain that is coming. I should also say the SNAP pieces have gone into effect. Medicaid is more delayed. The provisions in general, I said towards the end of next year, but SNAP, the provisions go into effect immediately. And then in related to increased demand for private philanthropic dollars, more competition, of course, amongst grantees seeking support. Those two things go hand in hand. And then this is the one of the biggest pieces when it comes to, again, our collective advocacy. There's definitely more pressure on state budgets. Cuts are going to happen unless there's new revenue. So we really collectively need to push the state to not just turn to cuts, but to think about fair ways of raising revenue in order to plug at least some of the holes that HR 1 is putting in state budgets. And that should be the last slide on this.
Thanks, Nadine. We did get a couple questions in chat. I don't know, Nadine or Sarah, if either of you are equipped to, on the spot, address the exemptions available for work requirements for SNAP or Medicaid. If not, we can follow up with other resources. But somebody asked about, especially for folks with disabilities, intellectual or otherwise,
I can,
how
it's
are they?
for Medicaid, I can quickly pull a list together for exemptions. The thing to keep in mind with the exemptions for Medicaid and SNAP is two things. One, just because somebody's exempt doesn't mean they're not going to be impacted, because we all know there's policy and there's implementation. And even with the best intentions, people will fall through the cracks. So keep that in mind when it comes to exemptions. We have to monitor and do advocacy year round, basically, because of this. And then two, the exemptions, some of them are not fully fleshed out yet. So we have an opportunity to advocate with our state to be as flexible as possible with who gets to be part of the exemptions list. With that, I'm going to find the list and paste it in the chat, at least for Medicaid. I'll need a little bit more time probably for SNAP.
Can jump in for SNAP. I know that they eliminated some of the existing exemptions. There are still exemptions for people who are unable to work, but there were previously exemptions for people experiencing homelessness, for veterans, for youth aging out of foster care, and those were removed. So if you're working with any of those populations, you should be aware that they will no longer be exempted from work requirements for SNAP, which of course makes it very difficult for them to be able to access these benefits.
Thank you. And I found a couple links just in my quick and dirty just now to put in chat too. So hopefully those are helpful. Does anyone else have questions about any of the charitable tax policy, Medicaid or SNAP changes in HR1? It's a fairly consequential piece of legislation is an understatement, probably once in a generation, and something that we all need to get our heads around. It's going to change fundraising and service delivery practice, and of course, the real human impact. So anything we can do to help you all get your heads around it, or lift up your examples of how you're responding effectively, if you'll keep us posted as you learn how to navigate the impact. We'd be happy to feature things that are working in the field. There's a question in chat about volunteers who are attempting to earn hours to meet the service requirements. Anyone have knowledge about how to use service hours to meet work requirements?
I know for Medicaid, um, generally speaking, it can count. Service hours volunteer can count. What we're waiting on, at least from the state, probably from the federal government as well, because this is related to the work requirement, is any additional guidance as to like what counts. Like, are they going to be just as flexible as possible, and how you document it and how you prove it? So those are the pieces. But generally speaking, volunteer time is part of the like buckets that can count towards that work requirement. But again, you still have to prove it. And that's where the people fall through the cracks in the proving part, not in the doing part. Most people on Medicaid do work or are exempt already from the work requirement. So
Nadine,
there'll be more.
do you
Go
have
ahead.
a source for that? The list you put in chat, is there a link you can share, or is that just from your own notes?
Oh, it's from I'll see if I can find it in a link. It's from
Okay.
a PowerPoint that we like, a template PowerPoint, big
Yeah,
one.
it'd be helpful to have the source on that, but I appreciate the list too. Thank you. Sarah, are you able to tackle Peter's question about changes in corporate giving?
Yeah, so a good example would be, let's say you have a local ice cream shop and they normally give 1% of their taxable income each year in charitable giving. Maybe they help support the local softball league or other after school programs, right? Well, currently, if they were to still give at the same amount, 1% per year, they would receive zero tax benefit for it, because they can only claim a benefit in excess of that 1%. So they might decide going forward that rather than giving every year at 1%, they'll give every other year at 2%. The same amount of money would be provided, but in that way, they would be able to maximize the corporate benefits for charitable giving.
Thanks. And Peter, there's As I pointed out in chat earlier, there's a really detailed, like too long didn't read version of our analysis on this bill in chat and on Forefront's blog that summarizes some of that stuff. And so folks can go back to that and look at the different charitable giving pieces in our analysis. It has some of the links and um, estimates about impact that Sarah referenced in her comments. Thanks, Nadine. I see you've shared some analysis. I'm going to hand it off to Sebastian, my teammate from Forefront now. Some of you may not have met Sebastian yet. He joined us late in October. We're so happy to have him on the policy team. He just came to us from the Illinois Senate. So he's hitting the ground running, and we're lucky to have him. So he's going to talk about some coming opportunities and ways to get more involved. And before I hand it off, just wanted to thank our panelists so much for your time and expertise. And if anybody has follow-up questions and needs to connect with one of these panelists, you can reach out to us anytime and we'll be happy to introduce you. And Emily has shared a evaluation in chat that's a very quick evaluation that we'd appreciate your feedback on. So Sebastian, go ahead.
Yeah, thank you, Holly, and thank you everyone for joining today. I know a lot's going on. The holidays are on the corner, so we appreciate you all taking the time. I was joking earlier with friends that even over the Thanksgiving holiday, the news out of DC was nonstop. Even though I was like, oh, I thought it would be quiet. Nope. Um, so getting involved is very important now more than ever, and we appreciate you all coming to events like this. So I'll run down a few events coming up in the near future into the rest of the year and then early 2026. On December 15th, we will be joining a coalition of folks from across the state to discuss the state budget and the effects from federal actions on the state going forward. We will have folks from the Chicago Coalition to End the Homelessness, from Illinois Partners for Health and Human Services, and other organizations come together to discuss federal and state budget developments and opportunities to take action through shared advocacy in the sector, but also just across the state for things for folks to keep in mind as the General Assembly in Illinois is set to reconvene for its spring session in January. And then on January 29th, Forefront will be kicking off our legislative agenda. So we'll be discussing with all of you, anybody who's interested, our state and federal policy priorities for the new year. So things happening in Springfield, but also bills that we're tracking in Washington, D.C. as well as Congress enters the second half of the 119th Congress. So we are in the works right now finalizing our policy agenda for the new year, but that will be shared pretty soon. And then that webinar will be available to anyone who wants to learn more about what we are advocating for on behalf of the sector in the state capitol, but also in DC. And then on February 12th, we are having an Advocacy 101 training for private foundations. So for folks who are interested from the private foundation world, how to go about meeting with elected officials, whether it's in Springfield, DC, in your own community or city, rules for registering as a lobbyist and all of that, ethics. We'll be going through how to go about private foundations and how they interact with lawmakers on February 12th, and that will also be virtual. And then on March 9th, we'll be having a training for the annual Foundations on the Hill, also known as FOTH, which is taking place this year on March 16th through the 19th in Washington, D.C. That is an in-person, 3-day long on the Hill day in D.C., where Foundations, Forefront, our board will be up on Capitol Hill advocating for issues that are impacting the foundation world. So we'll be advocating for federal policies. And so we'll have a training leading up to that on March 9th for folks to learn how to go about getting engaged and how to go about interacting with lawmakers, the bills that we'll be prioritizing when we're on the Hill. And then March 16th or the 19th are the actual days that we'll be in DC. So more information is coming out about that. FOTH registration is open, so folks are encouraged to register for that. And then Forefront will be putting out more information as well in our newsletters on stuff that we are trying to educate folks on looking ahead to that. And then lastly, April 1st, we are having our statewide census stakeholder meeting. I know we're only in 2025, but the census is coming around quickly. And with everything going on, we are starting to prioritize that in the state legislature, talking to folks about what's going on and how to best prepare as we ramp up to 2030. So we will be having a statewide census stakeholder meeting, and more details come about on that event in the near future. And then lastly, we have a great events tab on our website that runs through the events happening from our policy team, but also other events that Forefront offers in our various different departments that we have, our library and our amazing folks there. So if you are ever interested in signing up for additional email notifications or invites or other events related to policy or not, feel free to go to our website and register for anything that might pique your interest.
Thanks, Sebastian. It's really important if you're not already signed up for our Policy Action Center to do that. That way, in the spring, when stuff starts flying and moving, you're getting those alerts and can follow what's going on in real time. And one opportunity that we didn't cover today that has been in place all year that I just wanted to briefly mention while we have an extra minute is the Illinois Gives tax credit, which went into effect at January 1st of this year. So we're in the first year of that being effective. And there's still some tax credits available. And what that tax credit does is allow nonprofits to benefit by using a 25% state tax credit, state income tax credit to fund gifts to endowed funds at community foundations that can then be a source of predictable, stable capital or general operating funds for nonprofits. And we really want to encourage folks to take a look at that and make sure we want to make sure folks that typically haven't benefited from tax policy, whether that's like smaller organizations or groups serving or led by persons of color, especially in this time that you tap these resources. So whether that's Illinois Gives or the coming improvements, arguable improvements to charitable tax policy at the federal level that Sarah covered. So if you need help or technical assistance sorting out how to benefit from these programs, you can let us know anytime. And make sure you let your development folks know about all of these opportunities and changes because we know with all the pressure created in other ways by what the federal government's doing and the state's budget challenges, private fundraising is going to be more important than ever. We know it can't replace or supplant what the federal and state do, federal government and state government do. It's impossible in terms of scale, but it is a tool that can help alleviate some pressure. So let us know how we can support you. There's a lot of links in chat. We'll package all of those for you in a follow-up email along with the recording and the slides. And so I just want to make a final call for questions. And if we don't have any, then we'll wrap up and give you 5 minutes. A huge thank you to our panelists. It's a very busy time and folks tend to want to start checking out and we call it circle back season, in December. So we really are grateful that you were here today and willing to be with us and all of you for attending. And stay in touch. Let us know how we can support you in the new year. And I hope everybody has a wonderful holiday season. We'll stick around for a minute in case folks have questions, but we'll go ahead and turn off the recording and send you on your way. Thanks so much.